Hi, everybody, and welcome to the Kidney Coach YouTube channel. I am naturopath Fiona Chin, co-founder of Kidney Coach and Kygenesis, a range of supplements designed for people designed for people diagnosed with chronic kidney disease, whether you want to decrease your creatinine levels or bump up your eGFR. That is what Kygenesis is for, and I'm joined again today by one of my favourite guests, the beautiful Lindsey Zirker. Lindsey is a renal dietitian with Kidney Nutritional Institute there. She's a published author, and she probably better than anybody knows dialysis very well from a clinical renal dietitian point of view. You worked in the dialysis centres for a long, long time. So I know you have a passion of making sure that nobody ends up on dialysis after everything you saw through there. Lindsey's also a master genius when it comes to all things minerals and then the role that they play in the hormonal system. So we did a big series on minerals, and now we've moved into, because I really strung up listening to doing this, into the hormonal pathways involved in chronic kidney disease, because she is my resident expert in all things that, because she's now a published author for Springer Nature on the topic. So you can't hide from this now, Lindsey.
Terrifying.
So I don't they say the best way to know what you know is to teach it. So now you're just taking everything you learned and teaching it. Isn't that how this goes?
100% agree. Yes, very much.
Oh, good. Okay, so without further ado, we are going to explore all things related to the Renin-Angiotensin system, commonly known as RAS. So first off, why don't you just tell us what this system is, and then we'll go into its implications in kidney disease and why it's so important.
Yes. So yeah, this is when people talk about like renal endocrinology. This is definitely one of the big topics because high blood pressure and kidney disease, they seem to go really hand in hand. And a lot of times it's, people trying to figure out if it was a chicken or an egg situation because high blood pressure can contribute to kidney damage and then kidney disease. And then also kidney disease can contribute to high blood pressure. So the renin-angiotensin or RAS, which is so much easier to say, thank goodness for acronyms. This is one of the ways that the body, like a primary way that the body maintains blood pressure, um, so that you can live your life and that it can increase or decrease depending on what your body's needs are. So, yeah, so that's what it does.
So,
So
so tell us more about the physiology of it. So it's a feedback system.
it does seem to be, at least in part,
Mm.
um, it's primarily a feedback system, and it's kind of like, um, I don't know, I feel like they always talked about hormones like having cascade kind of
Mm.
things, and we know that's not a complete picture of how hormones work, but I feel like in this instance, to understand RAS, that the cascade kind of idea is really helpful. Or you could even think of it as a domino effect that can also stand all the dominoes back up and redo it, however you want to think of it.
Do you want to
So,
work us through what those dominoes are? Because I think that's really important for understanding RAS, or at least that's how
absolutely.
I learn it.
So the dominoes are in the name. So we start off first with renin, and this is a hormone that is produced in the kidney, in some of the specific types of kidney cells. Interestingly, it acts primarily on liver cells, which I was like, when I like my brain grows enough that I can dig into this more, I'm gonna figure out why, these hormones act in places that seems weird. So it acts on the liver cells, and this is the release of renin happens when you have low blood pressure, you don't have enough sodium, or sympathetic activation, so fight or flight mode is activated. So maybe your blood pressure is fine, but this is kind of where stress comes in. Um, so if your blood pressure is fine, but then your body senses a stress, um, actual or just, emotional, then it's going to further increase your blood pressure. So that's what gets Renin started. And then in the liver is where the angiotensinogen is, and that gets cleaved. Renin cleaves angiotensinogen from the liver into angiotensin 1. And this is kind of where things kind of start feeling a little bit more familiar,
Mm.
because then angiotensin 1 gets converted to angiotensin 2, and this actually takes mostly place in the lungs, which is sort of weird. But it also, it impacts, again, a part of the kidney. Um, and it is done, this angiotensin 1 to angiotensin 2 conversion is done by, why didn't I have the thing? Oh, angiotensin converting enzyme. I was like, I know this. ACE. So a lot of people who have high blood pressure, they might think, oh, I've heard the term being on an ACE inhibitor.
Mhm.
That is how it works. So the ACE inhibitor is disrupting the RAS system by not letting that conversion happen. So that's kind of how that works. So once angiotensin 2 is active, it is going to increase the blood pressure by constricting the blood vessels, and it's going to release aldosterone, which we talked about last time,
Mhm.
and antidiuretic hormone. And so, just as a quick review, aldosterone is going to reabsorb and prevent the loss of sodium and water. So, remember, if your body's low in sodium, or the blood pressure is low, sometimes like blood pressure could be low from dehydration or blood loss. So, that's where aldosterone's pretty handy. So, it's going to reabsorb that, and that's going to increase blood volume. And then the antidiuretic hormone is going to reabsorb water from different parts of the nephron. And so these things are going to help increase the blood pressure. So that's what happens.
And you've got
Um,
obviously you mentioned ACE inhibitors, and then another form of drug class for obviously blood pressure is your angiotensin
yeah,
inhibitors. Angiotensin,
I know. Why can't I think of that name right now? I'm not
they,
going to
they
be
work
very
on the
helpful with
angiotensin
that.
system. It's
Yeah,
ACE inhibitors, and they're not angiotensin system, they're angiotensin 2 somethings, those guys.
yeah. I thought it
Okay.
was interesting how the half-life of these hormones is fairly short.
Oh, tell me
Like
more.
Renin's half-life is 10 to 15 minutes. So in that time period, it travels to the liver, acts on the hepatocytes, gets tensinogen to produce angiotensin 1, and then the ACE, angiotensin converting enzyme, converts angiotensin 1 to angiotensin 2, and then angiotensin 2, the one that does the main job. Angiotensin 2 has a really short half-life, 60 seconds.
Wow. So this is going to feed us into then kidney disease because obviously one of the things with kidney disease is we get, and you mentioned it right at the beginning of the podcast, chicken or the egg, is the elevated blood pressure caused by kidney disease or, and it's bidirectional in a lot of cases, or is the high blood pressure causing the kidney disease? But now
Yep.
you're talking about a system with a 60-second half-life, meaning then it's going to have to be replete it and if you're going exactly so if you've got that going on all the time and I'm going sideways here but then it really does beg the question about the role of things like stress and fight or flight which this system is built for really that's kind of you're raising blood
Yeah.
pressure and I because you might need a short burst so it makes sense to me that these have short half-lives so how do these things become then chronically dysregulated where something that should be short acting suddenly becomes chronic.
Yeah. So, um, it is helpful sometimes if you kind of know the root cause of your kidney disease because then you can see if, what's been happening first. But ultimately, the big issue, which is kind of a root issue for a lot of kidney diseases, is that there's reduced blood flow to the kidneys. Because
Mm,
remember, what's one of the ways that The RAS system boosts the blood pressure, is it constricts um, the blood vessels, and so that means you're gonna not have as good of blood flow to multiple systems, but also the kidney. And
Mm,
so the impaired blood flow is, and then again over time, because it's chronic high blood pressure, typically over time, that is this, slow, what they call an ischemic kidney injury, a slow
mm.
oxygen depletion. And I know we were talking earlier about like what kind of herbs and stuff can help. And I know that we're looking at specific ones, but there's some of the herbs that specifically work on microcirculation. And so
Danshen. Yeah, Danshen's the big one that
yeah,
does
it's
that.
Danshan. Can never remember. So that's one reason why I really like some of these herbals is because they kind of can just amplify the type of support that's needed. So if somebody's been having a slow kidney injury for decades, then we've got to just help like infuse all those
Mm.
capillaries with oxygen and nutrients so that things can potentially start healing.
Well,
Um,
makes sense. Yeah, Danshin and Tianchi Nodo ginseng are the big two that will bring blood flow back into the kidneys. But Danshin is known as you know, we used to use it for women with having heavy periods and lots of heavy blood clots. It's
mm,
a thing. But now we
interesting.
know it's really good for ischemic disease and microcirculation.
Yeah. So that's kind of one of the things, and then kind of going along with this, I don't think we've talked much about this, but um, thyroid health has a really big impact on kidney disease, and that is partly because the thyroid hormone really helps with blood flow to the kidneys. And so one of the studies that I read said
Mm.
that hypothyroidism can cause a reversible reduction in GFR by like 40%.
40%. I mean, I knew
Yeah.
they were. I didn't think, I thought I was 10 to 15% if you were going to ask
And
me.
I was like, oh. So I especially think, I mean, thyroid
Wow.
disease is really common, and that
Mm.
has an impact on the RAS as well, because the thyroid impacts the responsiveness of most systems in the body. And so, um, people that come into me that have, issues with their blood pressure and they're also on a thyroid medication, I'm definitely looking at that to say, okay, like, you know, if you're just on a T4 medication and you don't have enough micronutrients to help that T4 get converted to the active T3, then your medication is basically useless. So let's make that work. And then that can help with better management of the RAS and more again oxygenation and blood flow to the kidneys. Um, so yeah,
So
I've definitely had patients improve with working on their thyroid.
interesting. So for people
Strange
that don't,
story.
is it you're talking quite specifically probably about selenium in that case then, right?
I'm looking at selenium, choline, folate, zinc, iron. I feel like there's another big one I'm missing. Oh, vitamin C and
Mm,
iodine, obviously.
I don't, yeah.
Yeah, but yeah, definitely selenium's up there. Zinc is usually up there because, there's so much loss from the kidneys with CKD, and also um zinc deficiency also alters the angiotensin converting enzyme, and it can lead to an accumulation of angiotensin too. So it kind of
Oh,
messes things up with the RAS system. So I'm like, how does that work with no one's really looked into it, but I thought, well, that's an interesting tidbit that, you can't really judge what's going on with this person's blood pressure if they also have a zinc deficiency. Things are going to be weird. So,
yeah, no, you're right. It's not one that people are going, okay, well, we've got blood pressure issues. Are we thinking about zinc? And I mean, definitely thyroid, something I'm looking at with hypertension and things like that. But I know the bulk of, literally had a patient right before going on this call. And yeah, reeling off all the practices I've seen. I'm like, has this been checked? Has this been, no, no. I'm like, wow. And same thing, like, are you thinking about
yeah.
things like zinc in thyroid or chronic hypertension and things like that. So yeah, it's
Yeah.
fascinating what gets missed, because and this is why there's hormones, and the talking to you is so fascinating, because when you really dig in, and I'm sure when you were writing for Spring of Nature, you probably came up with this, is just how interlinked these systems are and where the crossover is and where do you pull them apart and where are they separate and where do you, exactly, like, it's like, did you end up feeling like you were Alice down the rabbit hole and you're like, well, we said this a couple of times ago, I think before we hit record, it's like the more you know, the more you realize you have no idea what you're doing. You don't know about these systems.
Yeah. Yeah. Well, and it does make me feel at least somewhat comforted. Like, even if I don't know all the things, at least I know like these things can have an impact. So if I really want to understand what's going on, I need to make sure these things aren't muddying the waters, like stress, like, inadequate micronutrients, because of course hormones are going to be messed up when those two things are, wacky. And so it kind of makes me feel more confident that I don't have to know every single little thing. Like, okay, like knowing zinc deficiency impacts, that enzyme is cool, which I love, but I don't have to know that to help my patients with their blood pressure. I can say, let's help you feel like, let's help calm down your nervous system and better cope with stress, and let's get you well nourished. And then let's kind of see where things land. And, I feel like that's nice because that doesn't take usually too many expensive tests or crazy things. Like, you just, focus on that.
Yeah.
So,
Yeah,
yeah.
nice. So kidney disease, what have we not said about that? So obviously
Yeah.
talking about that pathway with elevated blood pressure, but tell me more about the link between the RAS system and the
Yes.
renin-angiotensin and angiotensin converting hormone and just exactly enzyme, how that all goes then into chronic kidney disease and how it all fits in.
Yes. So we're kind of talking about the impaired blood flow that occurs because of like, different stresses or injury or things like that. But also there outside of kidney or outside of like thyroid disease, there's other conditions that can contribute to that. Acute kidney injury. So like if someone, has a car accident where they injure their kidney, or I've had patients with contrast dye kidney injuries, um, and things like that. Chronic dehydration, um, those kind of things. Those are all going to impair blood flow. Chronically high salt intake. We're going to talk a smidge more about that when we get to our micronutrients. Diabetes also can do that.
Okay.
So those are, things that kind of is like a risk factor for reduced blood flow to the kidneys. And then what happens is that reduced blood flow causes a gradual loss of nephrons. So that's going to activate some maladaptive mechanisms. So this is like the perpetual release of renin to attempt to increase the perfusion of, all the solute delivery where it needs to go. And so then you have this chronic activation of RAS, and you're going to have hypertension in the glomerulus, and that's going to
Mhm.
cause that hyperfiltration. And so that's like specific diseases like diabetes, where we see lots more protein in the urine, and other glomerular diseases like that. Also, you can get more fibrosis in the kidneys because of different growth factors, because they're trying to upregulate their receptors to handle that chronic release of that angiotensin 2. And then you also have increased T cell and macrophage activity, which is going to increase cytokines and inflammation and oxidative stress, which is going to cause more fibrosis or
Yeah.
scarring, and then endothelial dysfunction. So that means it's going to be really hard for the blood vessels to respond if they should dilate or if they should constrict. Like they're just kind of like, what are we doing? And then they can get kind of stiff. So that's what happens in kidney disease.
Wow. So to sum that out, what I'm hearing is it's that RAS system is generally triggered by a lack of, let's say, blood flow deep inside kidney tissue. So perfusion in there, kidneys are like, we need more blood flow. Then you get this maladaptation happening. So it's like to get more blood flow, what we know to do is we're going to hijack up the blood pressure to try and pump more in, which of course does the opposite effect because it's causing more vasoconstriction. So in their attempt to get more blood flow into the kidney tissue, the opposite happens. Then you get, yeah, you get these poor little kidneys. I feel so, when you're tired, like, I feel they're so confused. And then they're getting tired. And then, of course, like you say, you've got more macrophages going in, kidney fibrosis. We've got, you know, the hyperperfusion and everything else going on. And it is really a very big maladaptive cycle that's going on with kidneys basically like what I hear is when the RAS system's out like that and you've got, say, blood pressure being caused due to kidney disease, that is the kidney screaming for nutrients and for oxygen and for just a bit of love to go into them.
Yeah, it makes me wonder like if it would be possible like catching it early enough. Like so when someone has high blood pressure, I mean, we know there's genetic factors and dietary and stress and stuff like that, but eventually it is going to lead to kidney damage
Mm.
because that's how it works. And so it's just like, what if we thought about, we're like looking down the road and being like, okay, like obviously lifestyle factors, but like focusing on what things can we do that are going to promote oxygenation to the kidneys. So this is where like last time we talked about, aldosterone being too low, but when people have that chronic RAS system going on, aldosterone is typically high. And so this is an option where obviously we want to correct the root issue. So like if it's thyroid or whatever, but while you're kind of figuring things out, something like nitric oxide could potentially be helpful because
Mm.
that is going to help open up the blood flow to lots more of the tissues. And like some of the herbals we talked about, it's going to do that.
Yeah,
So,
you're absolutely right. NOS is something that you would definitely think about activating, especially if you've done a gene profile and they've got NOS SNPs. You would be,
oh yeah,
yeah,
which
you'd
I
be
feel like a lot of our kidney patients do. Like I was
right.
going back and looking through, I was like, I'm seeing this so much.
Yeah,
So,
yeah, I'm like you. It's crazy how often I'll see NOS genes. And you know, you'll have compounded hetero or homozygous SNPs in kidney with NOS. I think there's three or four NOS, like NOS 2 and 3. You see a few of them there together. So I went back and looked after we spoke about it as well. I'm like, yeah, wow, so many of my kidney disease patients have SNPs on, or, whatever you want to
yeah,
call it, expressions on the NOS gene. So
yeah.
that's fascinating. So micronutrients. So is there anything else you want to say about that system before you move on to the nutritional part of it?
Um, no. Yeah,
Okay.
let's go into it.
Yeah, so tell me more about these micronutrients. And you talked about sodium, so we probably need to come back to that one too.
Yeah, we can definitely start with that. One of the things that I thought was really interesting in the research, it talks about excessive sodium intake can trigger the sympathetic nervous system, especially when it's in the presence of low potassium, low magnesium, and low calcium.
Interesting. Yeah, okay.
And so it kind of made me think of, the whole low fat for heart health thing. It's just like, oh my gosh, saturated trans fats are going to kill us and everything. So everyone's like cutting those out and we're not really seeing benefit. And now all the studies are coming out of how it's like, well, actually, you have to have the healthy fats in there for anything to really be helpful. And I feel like we see this, I see this a fair amount. I have lots of patients who come in and they're very diligent, in fact, even too low on sodium sometimes, but their blood pressure is still like they're still on medications and stuff. And sometimes that's because like that's where they're at in the progression of things. But monotherapies for chronic disease can never be very effective because there's so many different factors that are contributing of like how many systems had to break down to get you here, so you can't just do one thing and it's going to really work really well most of the time. And so I thought that was a really interesting piece that high sodium intake triggers that stress response system,
Mm.
which interestingly, um, I was looking at it too, that cortisol is going to increase the production of angiotensin 2 and enhances aldosterone activity. And
Mm.
so it kind of compounds things. So if you have a high sodium diet, but you're very low in those other alkalizing minerals, then that's going to create a whole other system of mess there, that, you know, you haven't probably thought about. And I think it also can explain why some people, they can eat higher sodium diets, but if they're also eating nutrient and mineral rich diets, then their
They're
body
okay.
has the compensatory um, mechanisms to help, cope with that.
That's exactly right. I know Jessiana and I have spoken about that with when she'd gone into the rabbit hole of studies that often, we take sodium lower and lower, but often sometimes the blood pressure, it's just not enough of the, alkalizing minerals to offset the sodium. And so, and that probably comes back to this whole RAS pathway, right? So when you get all of that right, they've probably got on and off mechanisms that work in the background there that we, don't completely
Yeah.
understand, or at least compete. If you're talking about receptor sites, and we know deep inside the cells on the, so on the ion channels and things like that, you may be working on a deeper level there that we just don't understand when it comes to RAS. So interesting with
Hmm.
sodium. What other micronutrients are you thinking of when you're like, okay, the RAS system's been hyperactivated and we've got a chronic broken sort of system here? What else would you be looking at when it comes to supporting that system with nutrients?
Definitely potassium, um, because potassium um, is going back here, that helps so much with the blood pressure, because like if you have chronically low levels of potassium, um, then that is going to activate other pathways, because it's just like, we cannot quite get these minerals straight. And I personally have found in clinical practice that my patients, unless it seems like maybe, the genetic SNPs where they might be more salt sensitive, but I found that my patients to be more potassium sensitive.
Mm.
So they this happened like super commonly. They're following a plant-based diet on their own, and they come to me because they're like, oh, XYZ things are not working how they should. Like, I thought my blood pressure would be better. It was better initially, but now it's worse than before. And then I'm looking and I'm like, well, you're eating 1,500 milligrams of potassium a day. That is not going to cut it. The American Heart Association recommends at least 3,500 milligrams a day for blood pressure control.
Mhm.
and and so um, that really seems to help blood pressure a lot, if they can get more potassium on board. Um,
Interesting. Okay, so definitely potassium. That makes sense to me. What else have we got in there?
so we kind of mentioned um, magnesium as well. That's super important for I think the big role that plays is with that vasoconstriction and smooth muscle contraction.
Yeah.
Magnesium helps a lot with that. And then we also discussed zinc. But antioxidants also play an important role, because antioxidants, when there's enough of them, obviously that helps control free radical generation and lipid peroxidation. When those levels get high, that upregulates the RAS system. So,
Ah,
inflammation and oxidative stress, lipid peroxidation, all those things, those are going to upregulate that. Um, so,
so all the things we
antioxidants,
say that drives kidney disease, right? Inflammation and oxidative stress. And then that's
yeah,
how you fibrosis. So yeah, it makes
hmm,
total sense.
yeah. Um, there's other vitamins. I'm looking through my notes here. So, um, let's see. Vitamin B6, vitamin C, and vitamin D, they both play a role with helping to regulate the RAS system. Um, in fact, what was I just reading about vitamin D with that?
I feel like vitamin D does everything for kidney disease.
Vitamin D does everything for a lot of things. I'm like,
Yeah.
I feel like, oh, something's wrong with you. Let's just check your vitamin
Check
D
your vitamin
first.
D. Yeah, exactly. I'm the
Oh,
same.
yeah. It inhibits the RAS system via the NF kappa beta pathway. Don't ask me about that. I don't know. But the end result is that it helps upregulate nitric oxide synthase. So again, we're looking at endothelial function, vasodilation for
Yeah,
that. So, and I feel
interesting.
like magnesium is kind of similar, but maybe not that
Probably.
same pathway.
Yeah. We were looking at taurine before because I thought taurine worked directly on the RAS, but taurine works on the baroreceptors and the parasympathetic nervous system. So my thoughts with taurine, because it's so good at
Mm.
managing blood pressure and heart disease, is it probably works in adjunct to the RAS system. I was looking for the article I wrote through, but definitely the baroreceptors, it's going to cause vasodilation. So it probably has a little bit of a negative feedback loop into the
Mm.
RAS system, I guess. And then, of course, we talked about the herbs. They're the ones that I'm all over. But yeah, any other micronutrients that are popping up or macros or aminos?
Um, Let's see. Well, selenium definitely for its antioxidant abilities, but also it is a vasodilator
Hmm.
as well. And then okay, we got vitamin B6. I'm like most of these nutrients, they work on like uh so many different levels of
Yeah.
regulating blood pressure, like as a diuretic or a sympathetic nervous system modulator, the RAS system, vasodilators, calcium channel blockers, antioxidant. We're consistently seeing magnesium, calcium, B6, vitamin C, vitamin D, vitamin E,
Oh, well,
selenium. Yeah.
lots of
Um,
thyroid supporting nutrients in there too. Not so
I know.
surprising. Mm.
Interesting, isn't it?
Mm.
So,
It's
yeah.
interesting how I look at all of this and excuse me, you talked about monotherapies can't ever be super effective for managing stuff. And it makes sense when I look at this and it comes back to probably somewhere we've had either chronic stress that has then triggered, this fight or flight response or a chronic RAS alongside nutrient depletion. So you've got changes to, yeah, excuse me, you've got changes to receptor sites and all those sort of things that's going on that when we have to treat holistically, we can't just give a monotherapy or a drug because we're not ever going to treat the cause. We have to come back and we have to look at all these potential contributing
Hmm.
factors. Was it dietary? What's the sodium levels like? Are we deficient in big nutrients like D, zinc? What's the thyroid doing? Are you chronically stressed? Are you exercising? All those things. And when you dig in like that, you go, wow, often the answers to that are going to come back to diet and lifestyle and nutritional deficiencies and things like that. And when as practitioners we can get that right. And obviously when you're having disruptions to RAS, you've got, as you mentioned last week when we were talking about aldosterone, a whole pile of other systems because hormones are so overlapping and connected
Yeah.
to other bits. We've probably got other things that have gone out sideways too. But when you can start to rein that in by really nailing the basics, diet, stress management, all of those kind of things. You have even if you choose to use monotherapy, at least if you're doing all the diet and lifestyle stuff, you have a much better rate of potentially not using so much or actually starting to re-regulate pathways, especially if you get onto it early. At least that's what I hear when I'm listening to you talk.
Yeah, definitely. Well, and I think that when you're doing like these foundational pieces that we talked about, the lifestyle and the diet stuff and stress management, it is going to make any medications that you take more effective.
Mm.
And so, yeah, like I've definitely had patients be able to come off blood pressure medications, lower their dosage, which is nice too, because if there have been any side effects, then the lower dosage makes those more manageable.
Mm.
Um, so, because yeah, sometimes things just get to a point where either a holistic functional therapy is going to take nigh on 50 years to work. So we got to do something in the meantime.
Yeah.
So the medication is awesome. And I love having so many different tools, but we can't keep using blood pressure medications, um, just like the hammer that works for all things. Like there's a bajillion different types of hammers. So let's use the right tool for the right job. And maybe we got to use more than one. So let's do it. And I think that's where like the the time period that we live in, we are not limited to just one or the other.
Yeah.
Like, I feel like, sometimes people are like, oh, well, conventional medicine's terrible, or alternative medicine's terrible, or Chinese is whatever, and functional is this. I'm like, how about let's just use what works
Yeah.
because that's what we need. We don't have to like pigeonhole ourselves into one therapy or another because we live in a day and age where we have the most options available to us. And
Yeah.
so,
I love that.
yeah. So use all the therapies. Do it all.
Well, especially when it comes to preserving kidneys, right? Like you want to get that blood flow back into the kidneys. That really is what's going to stop progression of kidney disease. That is the ultimate goal.
Yep.
So that makes complete sense to me. What else do you
Yeah.
want to say about RAS, Lindsay? Is there anything else we haven't mentioned about this fabulous hormonal system?
I think like we've talked about those micronutrients and I mean we touched on the stress aspect on
Mhm.
it. Oh, you kind of mentioned the macros. I feel like a lot of times we don't really think about macros when it comes to these kind of situations, but um I mean in general, like you have to have um fats to make a lot of different types of hormones.
Oh, I'm so glad you said this. Yes, fat is the precursor to like every hormone in the body. That's why fat can't be easy. Yes, yes. Thank you.
So we need it. Plus, fat, like the healthy fats, is one of the really great anti-inflammatory pathways the body uses. But your body cannot convert all those lovely fats into the ones it needs if you don't have micronutrients like vitamin C and B6 and all
The
the
delta six
things.
desaturase, right? That's the enzyme
Yeah,
that's
which
with
is
that.
zinc dependent.
Absolutely. And
So,
like you said, magnesium, iron, vitamin C, B3, it's
yeah.
B6. Yeah.
Yeah.
Mm.
So fat is important. And then amino acids play a lot of different roles with hormones and transport and all these kind of things too. So we need those. But then carbs. Carbs is like the easy culprit, like for all the problems, right? But especially if you have thyroid disease,
Yeah.
you need carbohydrates. You cannot be following a low carb diet and feel fantastic most of the time. Like maybe if you're like really in maintenance and it's everything is well controlled, but you really need to have carbohydrates. Also, if you have other types of hormone imbalance, like if you've been in a chronic state, chronic stress phase for a while, then it probably means that your adrenals and your thyroid are maladapted for
Um,
handling stress. And again, fasting, intermittent fasting, really low carb, you're gonna feel like total poo. Like it's not gonna be good. Your
so,
body needs that to better regulate your blood pressure or your blood sugar. And if you don't, then that is going to stress out your system and it's going to whack out your blood pressure. So, like, they all kind of feed into each other. And so that's why it still goes back to nourish your body and let's figure out how we can take care of this stress. Because again, it's going to be really difficult if someone's got a cortisol issue, adrenal issue going on, and they're like, well, I'm following this, keto diet because that's what's good for my diabetes and all these things and weight loss because I have to lose weight, otherwise my kidneys will fail. How many people have told me that? That's a lie. No, that is not going to work because your body cannot handle that kind of stress. It can't
yeah.
regulate blood sugar that way.
And
So,
that's the thing people forget. Those things are very stressful. They're going to add stress. So if you've got stress in the mix as being a major driver and you go, like, you're right, intermittent fasting. And I mean, it's one of the things I speak about all the time. I don't ever recommend a cold plunge to anyone with kidney disease. Just too stressful on that system.
and I think like intermittent fasting, I feel like the popularity of it has kind of ebbed a little bit. There's definitely benefits to having a fast, but
Mm,
that can be a 12-hour fast. If you've got all these hormone issues, you can still have benefits from a 12-hour fast. Um,
absolutely. The autophagy thing I think is important, but
yeah.
yeah, you don't need to be doing. I mean, I always freak out with anyone with long-term chronic diseases where they're like, I've done like a 7-day water fast. I'm like, eh. So,
I mean,
I mean, it does work for
it's
some people. Don't get me wrong.
yeah, I think it's really important to listen to your body, but I think if you have a really tiny eating window, it's very difficult to get in all of your macro and micronutrients that your body needs to heal. Like you need more nutrients than to heal than you do to maintain. So I
And
think,
that's a very important point.
yeah. So that's really kind of far afield from our RAS topic. But if we're talking about like how cortisol is going to impact your blood pressure and how your macros are going to be impacting your cortisol, like that's how we're tying that back together, I think.
Yeah, no, you're right. Well, it is. It's all part of the stress management part. And I love intermittent fasting. I intermittent fast. I use a lot. But you're right, with chronic disease and chronic stress where it's driving things like that, I am always not going to add perceived stress to the body, even though the patient might be like, well, I like that, I can do it. And I'm like, yeah, but it's starvation mode. It is causing stress to your body, and it's already stuck in hyperdrive, so we don't want to do that. So I think that's just having a good practitioner that can really lean in and listen to drivers and understand what's going on with the patient. So
Well, there's other factors too that, could, potentially make, fasting less stressful. Um, like the timing of it, or if, you still like give your body some fats, but oh,
bless you. Bless
excuse
you.
me. Um, Different things you can do. I think also one of the things with, with stress and fasting and all those things is that fasting has been such a great, um, positive thing for healing and health because of the mental work that goes with it. Um, and so when people are, thinking about like, okay, I'm like realigning myself with the universe or my God or, um, with whatever positive energy vibes or, those kind of things, then that makes fasting like a lot more powerful, I think, because you're including the mindset piece.
For sure.
So that's a piece that I think can help. And so, if your hormones aren't balanced enough that you can do like a full-on fast, then you could fast from certain things. It doesn't even have to be food. It could be, Instagram or whatever. Um,
Very.
but
Yeah.
but that's a piece. And then circling back to autophagy, because I was digging into gut health last week and it was talking about how a lot of the bacteria that are lower in people who have kidney disease are the bacteria to produce short chain fatty acids.
Yes.
And what they found in some studies is specifically that short chain fatty acids actually help enhance autophagy. And so I think that sometimes, if you're wanting that benefit, like working on the gut piece, if fasting isn't going to work for you right now, but you want, some autophagy benefits, then work on your gut and get those short chain fatty acids. And then, of course, we could go down the, rabbit hole of how that impacts the mTOR and everything. But I thought that's another piece of, how you have all kinds of different tools. So,
Yeah. And that's absolutely true. So I love it. What else do we want to say about RAS, Lindsay? Because otherwise I'll take you down the rabbit hole of microbiome and I won't take you there because we'll be here forever.
we'll have to do a separate one.
We
Well,
will.
I think like take home points for the RAS system is that, you know, if you have kidney disease, it's because your body is maladapting to still do its job. So it's just like you need to give your body some TLC. And we talked about how there's so many different micronutrients involved in that. And so don't just focus on potassium, don't just focus on sodium, focus on getting all the nutrients your body needs, and then it can use it how it needs to. And then, you know, figure out what's going on with what is stressing in your life. Can that leave your life, or is it something you have to deal with? And so get the tools to help you better manage your stress and figure out how to make that work. And that, I think, is a lifelong quest. But I think that that makes a difference. And then, I think it's really helpful to be able to monitor your blood pressure. Um,
Mm.
so that you can see what's going on. Because, a lot of people have, white coat syndrome. They get their blood pressure in the doctor's office and it's terrible. And they're like, they don't have anything to compare it to at home. So then the doctor's like, well, we better do something about this. And so, um, measuring your blood pressure accurately at home from time to time, and especially like right before a doctor visit, I think is a really helpful thing, especially like, if you're going to be making lifestyle changes, if you are, um, if you're on a medication and you need to see if it's actually helpful, then you need to monitor it.
Mm.
And then that way, you can see if it's actually helping. So I think um, I was going to just review. So to accurately do your blood pressure readings, this is what I've heard you need to do. Usually do a couple of weeks, do 2 to 3 readings
Mm-hmm.
at a time, and do them similar times a day after you've been sitting quietly for like 5 minutes. And then you want to make sure to keep your arm straight when you do it. And is there anything else we need to include with a blood pressure reading? Um,
No, I did an interview with a pharmacist who was saying exactly the same thing. Same time every day, track it, because she's like, you would be blown away by how often it's just straight white coat syndrome, and that gets missed.
yeah.
I've got a patient now that probably has been medicated and it's white coat and it's been on medication that's been harming his kidneys. So
Yeah. So give your doctor good data to work with. And give yourself good data to work with. And it's nice too, because if you are monitoring your blood pressure and then, you start some, if you are working with someone who's helping you with diet and lifestyle changes, then you're not going to have some kind of hypotensive crisis when
yeah,
suddenly your lifestyle and diet are really effective. You can be like, I am noticing a continual trend down. Then you can say, it's time to potentially make a change with my medication, and you can have a conversation with your doctor about it. So,
yeah, definitely. Especially if you're doing all of this stuff with the RAS system and you are on, ACE inhibitors and or anything that is blood pressure related, there's a good chance that you're going to see changes in blood pressure.
mhm.
And see, yeah, you're right. What else, Lindsay?
I think that's all I've got for now.
Awesome. Well, if you have been curious by this and thinking, maybe RAS is something that I'm dealing with, you can always reach out to Lindsay at the Kidney Nutritional Institute.org. I will put the details in below. Lindsay works with people as a renal dietitian all around the US and around the world because of the wonders of telehealth. So you can definitely reach out to her. As you can probably tell, she's very knowledgeable and definitely cares about her patients. So I often send lots of patients to her. And if you want to know more about what we do, head to www.kidneycoach.com, new website launching soon. And you will find us on social media, Instagram and on Facebook. Make sure you hit subscribe and like. That way you'll get notified anytime we put up more content. Lindsay, what hormone is next? What's next on your list?
Well, we talked a fair amount about thyroid, so maybe we should talk
Thought you
about
might say that.
that.
All
Yeah.
right. Thyroid hormones and TSH and T3, T4 coming down the pipeline to you next time.
Yes.
Lindsay, as always, it's a joy. Thank you for sharing your knowledge and wisdom with us all. I greatly appreciate you. And for everyone listening, thank you for being part of our community. We look forward to seeing you next time. Bye.
Bye, everyone.